Got a question about my thoughts on low-dose naltrexone and its relationship to thyroid antibodies. Well, the idea is that it acts as an immune regulator and it can reverse the autoimmune process and therefore cause it to go into remission. I've not seen really good data around this. There was a survey that I did many years ago on a Facebook group for low-dose naltrexone and Hashimoto's. And the participants, about 40% of them said that it temporarily lowered their antibodies. That's about as much data as I've seen, and that's not data I would put a lot of weight on. Thyroid antibodies do go up and down, sometimes for no clear, meaningful reason. So to see an overlap of people who take naltrexone and see their antibodies go lower, you would expect that, even if it didn't cause them to go lower, just because they do go up and down. It is a narcotic, and my thought is always, what's the real cause of something? How can we get to the deeper causes of problems? And the causes are never narcotic deficiency. And yes, for sure, low-dose naltrexone is safer than high-dose naltrexone, which is probably safer than a lot of other common narcotics or opiates. But to say that it's safer than others is like being the tallest building in Kansas. It's not a great thing in a group. So I wouldn't argue that taking it is the most important thing for someone to do with Hashimoto's. If the antibodies are high, the strategies are, why are they high? Is someone off on their iodine levels? Is their TSH causing a hypo or hyperthyroid loop? Have they been inadequate on selenium status? Are there other ongoing immune stressors? And if someone had covered all the bases, then the question is it important that your thyroid antibodies are high? If everything else is fixed and you're feeling well and you've got good scores, does that really matter? And I've not seen much evidence that it does, apart from possibly goals of fertility. So if your goals are not fertility and you've regained your health, I wouldn't see the purpose of focusing hard on the antibodies. So, just not something I would really encourage. It's not free of side effects. It's lower in side effects than many medications, but there are reports of people having seizures as a side effect. So given just the lack of compelling evidence towards benefit of lowering antibodies without treating the cause, you could take a high dose of steroids and lower thyroid antibodies. A massive dose of prednisone or a Kenalog injection can plummet thyroid antibodies. But is that moving you on the arc towards greater health? Not likely.